It's a big day today. Today's the day of your surgery. You've known it's been coming for weeks. You've met your surgeon a couple times. You have a good plan in place. But in the back of your mind, you know that means you're undergoing anesthesia. And you really don't know what that means. Here's a quick rundown of what anesthesia means by definition, how we think about it, and how we achieve those goals. So anesthesia has 3 goals. Each of those goals plays a part in the overall goal being your experience being quite good while undergoing a very painful surgery, which wouldn't be so great if you didn't have anesthesia. Now, the first goal of anesthesia is called hypnosis, which essentially just means unawareness. Now, there are certain surgeries where hypnosis is not necessary, and you can do a regional technique or a technique where a patient is aware. And that is in discussion with your surgeon and your anesthesiologist on if that's appropriate. But most people don't want to be aware during surgery, and we have medications that can make that possible. The second goal of anesthesia is what's called analgesia, and some would argue this is the most important part of anesthesia, and it's the inability to feel pain. Now, we have a couple techniques to achieve analgesia. Most of the time we're using medications through the IV, but sometimes we can use what's called regional techniques, which are like nerve blocks or ways that we can make a certain part of your body not feel pain. Now, the final part of anesthesia is what's called amnesia. That's basically just meaning you're not remembering the part of undergoing surgery. It does go hand in hand with hypnosis, but it is distinctly different. Now, the really cool thing about anesthesia is that there's so many different ways to achieve these 3 things: hypnosis, amnesia, and analgesia. But overall, the goal is to provide you with a safe, comfortable experience while undergoing what would otherwise be a very uncomfortable surgery.